International Webinar. I am sure this webinar will give some good information to you, change the COVID-19 situation in the opportunity for the teaching of our students and for the pharmaceutical industry also. I am happy to share with you that we have more than 165 pharmacy professors are registered with us from the different part of India and abroad. I just give some instructions before starting this program. I just ask you all the teachers to just put off their mic so that their voice will not be disturbed. I welcome all, and for the brief introduction, I just give the introduction about the speakers also. You know, we are having our chairperson of Apex Group of Higher Medical Institute and Hospitals, Dr. S.K. Singh, the chairman of Apex Group. Also, we are having the three keynote speakers, Professor Dr. Praveen Kumar B. Ingle, sir, from International Medical University, Malaysia. Dr. Sunil Mohite, sir, as project manager in TCS, he is work for Eli Lilly also, from Toronto, Canada. We have one more speaker, keynote speaker from Florida, USA, Professor Dr. Mayur S. Parmar, sir. I welcome you, sir. He will also give the keynote for today's program. For the inaugural speech, I welcome Dr. S.K. Singh, sir, to give some inaugural idea, and he is the actual idea of this international webinar. It comes from sir's mind. Sir gives some idea how we are going to convert COVID-19 situation as opportunity for pharmaceutical education and industry. I welcome S.K. Singh, sir. Please, sir.
With this, the only odd man out on the clinical side.
Mute all.
And I am a Dr. S.K. Singh, Chief Orthopedic Surgeon of the parent hospital, Apex Hospital in Varanasi. The Institute of Pharmacy is one of our unit, led by the Professor Sunil Mistry and his faculty team. Since COVID has to stay and we have to live with COVID peacefully, without panic the situation and fulfilling the requirement which will keep us safe and our country people and global citizens safely. We are hopeful that some of the vaccines, some of the medicine may come in the future, but it may not be sufficient to each and every citizen, and it may not be effective to 100%, as we have already experienced. HIV, measles, all vaccine, medicine, everything is there. In spite of that, we have to face the precaution with the medication and with our lifestyle. So today's webinar is on the pharmacy and industrial impact of the pharmacy of this pandemic event. As we know, pharmacy is the backbone for treating any ailment, even corona also. If not directly the corona, then complication of this disease, which ultimately become fatal for the human being. So that all needs taken care by the pharmaceutics, certain equipments, and certain safety PPE kit, as we know, and hygiene material for the personal, institutional, and office places. And not only this, but our transport vehicle and each and every walk of life is going to be infected, uh, affected. So I once again welcome you all the great speaker from the different part of the globe, Dr. Praveen, Dr. Mayur, and Dr. Sunil, along with our principal Sunil Mistry sir. So welcome. I hope that this information will enrich our all faculty member of the pharmacy with certain current information, what is globally being practiced and what we are going to face and how we can prepare ourselves for the future. Once again, I welcome and thank you, sir.
Thank you very much, sir. Now I would like to request our keynote speaker, Professor Dr. Praveen Kumar B. English, sir, from International Medical University, Malaysia. I welcome you, sir. So please start your session.
Okay, thank you very much. Just I want to request you, all of you. So can you please mute your mic so that there is no echo in that. Okay. So can you please mute all? Yeah. And also please give the share screen access so that I can share. Okay. Yeah. Now it's okay. Yeah, I can share now. Yeah. So yeah. Yeah, just a minute. So are you able to see Dr. Sunil? Just I want to confirm
Yes,
with
sir.
you.
Yes,
Are you
yeah,
able to see
yeah,
my
yeah, yeah.
presentation?
Definitely, sir. Yes, sir.
Okay. Thank you very much. Okay. So good morning, everyone, and the Apex family. Okay. So also online viewers, good morning to all of you. Okay. I would like to thanks as Dr. S.K. Singh. He took the initiative to organize this international webinar on the challenges in education, particularly in pharmaceutical education, okay, that mainly coming from the pharmaceutical industry side as well as education side. So here is a platform we can learn from each other, okay. So that's why I want to thanks to Dr. S.K. Singh, also the coordinator, Dr. Sunil Mistry, to organize all the speakers at this point in time, okay, and initiating this process, okay. So you have taken this challenge as an opportunity, and that is the case why we are meeting online today, so we can learn from each other. So actually today is a special day. Earlier I think Dr. Sunil conveyed me to have on yesterday this event, right? So today is a special day for me, like we are interacting with each other, and also today is my father birthday, okay. So just yeah, we'll start with the positive thought, okay. So there is no challenge more challenging than the challenge to improve yourself, to improve in the this condition, like challenging condition. So with this positive thought, I will start with my lecture, okay. So if we are going through the background of conventional teaching, so our conventional way of teaching is to use the blackboard, and then we blended our learning to have this online platform now today, okay. So many of our teacher, they are not very familiar with the online teaching, so they are more used to have blackboard teaching, and sometimes we felt that, okay, to whom we are talking, Okay, so it's an online platform, so that we need to think first, and then we need to teach accordingly to the students. So obviously it needs some practice to teach the student online, and also at the same time we need participation and involvement of the student to learn something new that we are not aware of. Okay, so to whom we are teaching, that is again another question in online teaching. So we are not sure, like to whom we are teaching, and that is the case why we don't feel it comfortable and we don't have the confidence to deliver. So obviously if you are delivering something online, so just today, instead of using the PowerPoint, I have used this platform. It's called as prezi.com. So I want to thank prezi.com for creating this platform. So actually the basic of this platform is freely available. So if you want to have the premium access, so you need to pay. So just I want to show you this new platform. So you can see here, so if you can zoom in and zoom out. Okay, so say suppose, like, just I want to give my introduction, so I can use these slides. So I'm Dr. Praveen from International Medical University, working as a senior lecturer and also the editor
I'd been working in market research and data analytics, and that's how I joined TCS. Many of them have questioned like, how come a pharmacist joins a IT company? So I have a different background. I took a different path after completing my master's. So I'm working in IT, but I work for a pharmaceutical company, and they are my client. So, and so let me begin. So now everyone is aware what is going on with this COVID-19. So we'll just quickly have a look. What's the scenario around the world with this current problem? It has impacted the entire world. The world is almost at lockdown, and it has affected all the business models and almost all type of businesses, small or large, and even the healthcare business, because of this pandemic, has undergone a big shift. It's almost like the healthcare industry is turned upside down because they cannot function normally. Now, because of this, a lot of other use of healthcare like telemedicine, non-personal engagement, virtual clinical trials, which were like negligible, but still services were provided. Now they have become the major part of the healthcare services provided by the doctors in the US, Canada. And recently, my daughter was unwell. So when I gave a call to doctor's office, they told me, you no need to come. The doctor will give you a call. I was given a time, and the doctor called. He asked all the questions. He asked to share a couple of photos, and then he gave a prescription of antibiotics, which was sent directly to the pharmacy store. And like in half an hour, I got a call from pharmacy store saying the prescription is ready for pickup. So things are changing. And to cope with these rapidly changing, all sectors and pharma industry needs to adapt very quickly, and they need to utilize an innovative business approach, because you can't stop your business for long. And pharma, like Dr. Ingle was saying, is one of the important pillars of healthcare and needs to be functioning at any condition or any calamity comes. It needs to work. It needs to get the medicines produced for the doctors. And as we are continuously monitoring the spread of COVID-19, pharma industry has no choice than to change immediately and apply new ways of doing their business. Now, as we know, everywhere we are having this social distancing issues, and same is the case with the pharma industry. So all the pharma industry, they have given instructions to their field force, that the sales reps, that avoid face-to-face interaction, keep them to minimum, and just do try to go virtual interactions, like how we are having this in virtual meeting right now. And because of this pandemic, we also see many patients are avoiding even visits to the doctor's office, because they just want to minimize their exposure towards this disease, and they don't want further complications with their health. And these sudden changes
ये समूह
have,
बता पाई यहीं आ जाओ भाई
मजा आ पहले कार ही करके लगे
काम बोला था
someone is speaking. Do they have questions,
Hello.
or they can mute it?
Sir, please mute it, sir.
पेमेंट कितना लागी
कितने बार कितने कह रहा हूँ
आता है मगर 7 गहिरान में हो गहिरान में बराबर है
Okay, we'll move on to this. We need to ignore them.
Yeah.
I don't know, they are wrong people joined to this meeting. Okay, fine. So the second few is like what we have seen and what I have seen personally educational institutions were very quick to adopt, and they transitioned very quickly to the online classrooms. My daughter, who's in like sixth standard, within a week's time, they were able to pull everything online. They moved everything to Google Classroom, and the schools are closed. So luckily, they were the fast movers. As we expect the lockdowns and the social distancing measures to continue and will be enforced, the pharma industry needs to quickly figure out different business model for them. Putting a stop to in-person physician promotions would reduce traffic across the sites where patients are treated. Clinical locations have also restricted entry or access to lower the spread of the disease to the healthcare providers, patients, and even sales reps who are visiting these offices. Now, a lot of companies, pharmaceutical companies, have asked their reps to work from home. And same as with my current client, they have instructed their entire sales force to work from home, and so they can enforce social distancing, and they need to reach out to their doctors, customers, remotely or virtually. Now these changes also bring in a huge new opportunities. It is a good time for pharma industry to revisit their existing business plan, which is more like a rep centric, and move towards um, towards on the virtual world, where people are safe and still they convey their message to the customers. Now, what impact does COVID bring on pharma industry? So we'll see ups and downs here. And so the first, on pharma companies, the positive side is uh, there is a huge demand, increased demand to produce drugs for prevention and treatment of COVID. The main focus is what we see is on the development of a vaccine for COVID. Now, if we look at the negative side, um, there is a big drop. All the pharma companies, like other businesses, are going to lose. They are going to lose huge revenues because they won't be able to promote new products what they have launched to the hospitals or offices. There would also minimum or no academic promotion of new innovative therapies, and this is typically true with oncology field, where a new regimens are needs to be promoted with the hospitals, and hospitals would then implement these new treatment regimes. And the worst affected field within pharma industry is clinical trials. It has become impossible to recruit new patients for the clinical trials. The next sector is medical institutions. Now, the positive impact is they are developing Internet of Medical Things. Earlier, at my company at TCS, we used to speak a lot about Internet of Things, and that used towards IT and mechanical fields. But this has surged the demand request to developing more and more tools for a medical or pharmaceutical industry. Now, there is also increase in third-party medical imaging and testing centers. We have here mobile X-ray centers, so they would visit your home and they will get the X-ray done. So, if these centers will increase, this will create a new demand of qualified technicians. Now, if we look at the flip side, there is a decreased number of patients seeking non-emergency. They are avoiding to visit if they can hold on or visiting to the offices or hospitals. They are just avoiding currently, just taking medications to avoid the problem. The doctors' offices are also preferring that patients with less complexities avoid visiting to the offices, and they should opt for telemedicine services. I just a few minutes back, I just told what happened with my daughter, how she was treated. The next affected field is pharmaceutical distribution chain and retail pharmacies. Now, the favorable this COVID has become more favorable to online pharmacists who are able to take online orders and ship the samples or deliver the drugs or medications to the patients to their home. It has also encouraged development of new convenient pharmaceutical apps which they could which patients would use to order their medications. Now, because the worst part is because of the traffic restrictions, what we have, ban on free mobility of private vehicles, this has affected the daily distribution of medicines to the retail pharmacies. So it's affecting, but still they're trying to maintain the minimum stock what they would need. Patients, like I mentioned earlier, they are avoiding going out to the clinics, hospitals. In same way, they are avoiding going out to the pharmacies. Rather, they would look for an option to order online. Now, about the health insurance. Health insurance is not much spoken in India, but if you come to US or Canada or any Western world, health insurance is one of the most important factor one has to look into. And with this COVID outbreak, what is happening is a lot of the lawmakers, members of the House in Canada, even in US, I have seen in the news, they are demanding to grow the commercial health insurance and also widen the coverage of the insurance for all people. They are asking the government to use the government insurance, the Medicare, to be provided for everyone. Now, on the negative side is that if this is implemented, if government issues an order to do this, um, and if probably they would also ask the pharmaceutical industry, insurance providers not to increase premium. So this would affect the health insurance companies. They would be uh, they would face losses with this.
ఏం
So
సుఖ
move
జాతి
on to.
కాలే బ్రాన్స్
So the pharmaceutical companies are bracing for the impact on sales, because if they don't meet the doctors, the reps don't meet the doctors, they don't promote their products, it will impact their business on a huge numbers. And we have also seen the recent news updates which came up where Pfizer, the world's largest pharmaceutical company, they instructed their reps not to meet the doctors, work from home, and try to use virtual customer tools to reach out and help their customers as much as possible. Similar instructions were given by Novartis. They have also asked their field force to limit face-to-face interactions and have encouraged their reps to use um, virtual tools to interact with their HCPs. And they said engage with them in person only if it is extremely critical, and to ensure appropriate patient care needs to be given. If they need medications for clinical trials and all that, only in that case they can go ahead with face-to-face meeting, taking all necessary precautions. The Japanese pharma company Takeda, they have also given out similar instructions to their employees to move away from healthcare sites and provide support virtually. And similar news is coming from other pharma industries, pharma companies like Boehringer Ingelheim, Merck, who are moving towards the virtual options to interact with their customers and assist them in any ways they can. Now, we are aware that medical devices are used by healthcare professionals. So we'll go through some of them which are frequently used by the medical professionals, healthcare professionals. Now they can access these devices on their smartphones. Majority of times they use smartphones, or they can use their tablets and computers. Now for I have categorized them into different buckets here. For information management, they would use these devices to write notes, dictate or record audio, take photos whenever needed, and gather information, or even to read ebooks and access their cloud services where they could have stored their data. Excuse me. And then they also would be using this for communications, for making calls, text, emails, multimedia messaging, video conferencing. They use it. They use these devices to schedule their appointments, manage their time, uh, have their calls. They use it for managing the health record and maintain access to it. They use it for their educational purposes, for continual medical education, knowledge assessment tests. If they have to go through their medical board exams or nursing board exams, they use it. They also use it for referencing. A lot of textbooks are available as ebooks. It becomes easy for them to read, have the access to books on these devices. They also have a lot of applications which would help them in clinical decision making um, in multiple ways. Uh, and you can see those things here. And finally, in patient monitoring, they monitor patient health, patient location. Nowadays, we are getting those wearable devices by which the patient health could be monitored. A good example is the health trackers or the Apple Watch. And then we'll go through the medical apps used by the healthcare professionals. For information management, these are some applications which they frequently use: Evernote, Notability, iAnnotate, GoodReader. And for storage, cloud storage, they could use multiple: Box, Dropbox, Google Drive. We use Box and Google Drive at our client, and they use it for communication and consulting. Uh, these are some of the options which they use for reference their studies and for drug references and medical news. For patient management, these are some applications which are used by HCPs: Diagnosaurus, Pocket Lab Values, LabPro, uh, and they also use it to calculate their medical dose, for appropriate dose for some patients. Okay, so let's move on to the next one. So we use Viva CRM. CRM is a customer relationship management portal, and it is provided by Viva, and it is based on Salesforce application. So these help the doctor reps to manage all their call activity with the doctors, sampling and everything. And I will quickly play a video. It's a few minutes video which will show how a rep's life is in US and Canada.
The video is not started, sir.
Okay. Okay, let me share this. Okay, so we'll move back to the next slide and just a few more slides and I would be done. So now with this COVID coming in, because doctors and reps were not able to meet in person to discuss and the medications and all that, uh, immediately pharma companies have to think of some online virtual meeting options, and we implemented GoToMeeting immediately. And there are some more applications which are frequently used by some other companies, and they are, and even you would be using, we're using Zoom here for this meeting. There is Edge Talks, Skype, TeamViewer, Ring Central, WebEx, Pixip, Google Hangouts, Join Me. There are many more, but I have just choose a few here. And now we are moving away from GoToMeeting because GoToMeeting had certain restrictions where uh, only two people could join onto the meeting, and screen sharing was limitation. So Viva CRM, they came up with an additional option called as Viva Engage meetings, which will help reps to have multiple customers on a call, and they can do exactly all the things like taking signature, providing, filling up a form for the samples and taking the signature and submitting that uh, while they are interacting virtually. So there are some benefits why our client chose Viva Engage. First one is it improves the customer engagement. It delivers the needed information to the HCP with convenient and compliant virtual content sharing. It also increases productivity and reach. It uses video to connect with HCPs regardless of their physical access restriction and geography. So suppose say if I was a rep and if I was stuck in India, I could still reach out my doctors in US or in Canada using these applications securely. And then the next one was it enables the content reuse and compliance. Uh, it helps the reps to stay on message. They don't have to toggle between different applications to share the screen and all that. It happens everything within the same application when they're using. So it's ease of use, and it helps the improved helps the reps to give an correct and specific message to the customer. And there are some important features of Viva Engages. Like I mentioned earlier, it is embedded within Viva CRM. So we don't have to use multiple applications. It's very easy for rep to use, and they're used to Viva CRM. So it's like an extension of a same thing. The most important thing, Viva Engage meeting is FDA compliant. It fulfills all the FDA requirements. And it is easy for HCPs also, because whenever a meeting link is sent through an email, they just have to click on that link, and if they're using a laptop or a computer, they can click a link and start the meeting. If they're using mobile devices, they need to install the Viva Viva Engage meeting app for once, and then next time it would just click on a link and they would be on to the meeting. Now I'll quickly show you a video on how um, Viva meeting is. Okay, so this was about it, and then so this ends my presentation. Thanks a lot for listening and sparing your time. Now, if anyone has any questions, they can either share it on the chat or they can ask me.
Information regarding how pharmaceutical companies working in this COVID-19 situation, how they convert these COVID-19 challenges into opportunity, how they are going to meet the doctors via virtual platform, how they are given the information regarding the drugs, tablets, and the formulations to the concerned doctors. Sir had shared some video, and sir also has shared some good platform they are using in their company, also from other companies. I very thankful to sir Mohite sir thank you very much for being with us. And sir, I think sir will be with us from next session also. If anybody having some question regarding sir's presentation or sir's keynote talk, uh, mention in the chat box so that sir will read it out and give the answer to you. Now, I request our English sir is join again with us. English sir, if
Hi.
permit or ready.
Yeah, yeah, hi.
Hello.
Hi, hi. Are you, am I audible to you?
Yeah, yes, sir. You're audible.
Yes,
Yeah,
sir.
yeah, yeah. Yeah, hi. Dr. Sunil, can I start now?
Yeah, yes, sir.
Yes,
Go
sir.
ahead.
Yes, sir.
Yeah, please. Yeah. Okay. So now you can see my screen.
Yes, sir.
Yeah. Actually, I'm not sure, like, might be like many disturbances are here, I think. So, okay. So we'll try now. Okay.
Yes, sir.
So now you can see, right, my screen.
Yes, sir. Yes, sir.
Yeah. Okay. So
Which
I will
visible.
start now. Yeah, yeah, yeah. Okay. Good morning, everyone, and then all the online viewers. Okay, and then I would like to thank to Dr. S.K. Singh. So I don't know where it stops actually, in between. So that's why I'm just thankful to Dr. S.K. Singh and also Dr. Sunil Mistry to initiate this lecture, and then we have taken this challenge as an opportunity to deliver this talk online, and then we are learning from each other. Okay, so today is actually special day for me that meeting you online, and also my father's birthday today. So I'm talking with the positive thought, like there is no challenge more challenging than the challenge to improve yourself in challenging time. So we need to think about the conventional teaching also at the same time, as many of our teacher, they are not well familiarized with the online teaching. So they are using Blackboard from many years. So obviously, if you're shifting from one platform to another platform, it takes some time, it takes some new skill to adopt. And again, one more challenge here in online delivery is sometime, we don't know, we are not really facing the people, we are not really facing the audience. So sometimes we don't have that confidence to talk in front of all, because we don't face the public, right? So that is the main basic challenges of online education and delivery. So here I'm using the new platform, that is prezi.com. So here the basic platform of this prezi.com is available online. It's freely available. If you want to have any premium access, you may need to pay for it. Okay, so here what is the advantage of this using this platform is to, you can zoom like this, you can see here the challenges and opportunities of online education. You can zoom out, you can see, you can give the, you can focus on any participant screen sharing, the option is coming like that.
Okay.
Okay,
Sir, it's showing, sir, to you, sir. Just check it out, sir.
Now is allowed.
Yes, sir.
Okay. So you can use my email dr_pvingle@gmail.com. So you can just allow me to participate in this, so that I won't be disconnected then.
Sir, I think you can share the screen, sir. Please check
Okay,
it
okay.
out, sir.
Sure. Thank you. Okay, so I will start with my presentation now. Okay, so here you can see, if I'm clicking on these particular images, so it will appear like this. So you can zoom in, zoom out. So these are the points that I want to just key points I want to raise here. I want to discuss with all of you. So it's like background, introduction, challenges, opportunities, and what message I want to deliver at the last. So these are the like background. As all of us knows, like COVID-19, it happens in late December 2019 as a novel coronavirus, and then it's also affect our education system. So many educational institute actually adopt the changes very quickly. Some university institute, they adopt the changes slowly, but now we have some idea like how we can go through the online teaching. So coming to the introduction point, so these are the like point that I want to discuss in introduction. This pandemic leads to closure of many universities, institutes, and colleges around the globe. So by having this pandemic situation, many institute already they close, and they are having and they are shifting with the online teaching. So what is the major challenge here? How can university, institute, or college deliver quality education if they cancel the face-to-face classes? So moving classes online is the first step, but what comes next? So you need to see about what exactly you want to teach, and then which platform, the ICT tool you are going to use for the teaching. So that might be teaching or that might be assessment. So obviously you need some planning to go for your teaching. So just here you can see the planning for online teaching. So here you can see the first column, second and third column, how you can plan your activity. We don't know when this pandemic situation ends. So might be, this might be helpful for our next coming semester student to have a look on it. So this is a very helpful for the teacher to plan their activity. So if they have any lecture, so they can plan with the Microsoft Teams or any other video platform. If they have the assessment like digital assessment, they can use the Google Classroom. If they have the presentation, they can use PPT with the voiceover, or they can use any other platform, the video sharing, so that they can watch the student, how the student is delivering. But at the same time, there are some pros and cons always. So as we cannot observe and we cannot monitor the non-verbal skills of the student, how the student is delivering the content, and then particular part is missing here. So obviously there are certain challenges and opportunities that we face in the online teaching. So what are the challenges and opportunities? So we'll just have a look on one by one. So communication skills. So obviously the communication skills that the teacher should have to instruct the student, as well as to develop a particular e-content. So e-content development, it needs a lot of time, lot of efforts, both from the faculty as well as from the student, if they are going to submit any assignment or having some digital assessment. So this is very important part, like communication skill need to be very. Coming to the next point is digital literacy. So need technological proficiency. So if you're using some digital platform, you need to have some technological proficiency, you need to use some new tools. So you need to already develop some new skills for it. So that comes under the digital proficiency. We do have some technical issues, like as I told you earlier, the basic things like the reliable internet. So sometimes we don't have the reliable internet, even though we have the Wi-Fi, it might not be stable sometime. And again, the compatibility of the devices with the new learning app. So nowadays you can see there are many new upcoming apps are coming, and that particular apps needs some updated latest version of device. So you need to be very update in regards with that. Student engagement, motivation, and adaptability. So in order to engage the student correctly in a classroom, because we are using the digital platform, so we need to engage the student in an appropriate way. So it's not only the conventional way we are teaching to the student, but it's all about their engagement. So they should not feel bored while listening to the teacher. So we can plan, we can have some brainstorming in between our lecture, we can have some quiz, we can have some poll, so that the student will be engaged all the time, and also needs motivation from the teacher, like how the student can cope up with this new situation. So as we need efforts from both the sides, teacher as well as the student. The student need to complete the task in given time, stay engaged, and make their progress. So if they lost in between, so obviously they need to take more time to complete their task, and also need to have more time. So in that situation, again, the next challenge we have is training. So we need to study any new skill, we need to learn any new skill. Obviously, we need to have the proper training, proper e-learning support for that. Again, we need to see what ICT tools we are using for delivering or assessing the student. That's why the role of blended learning comes here. So as we know that our conventional teacher are using the blackboard, and now the days come to have all the teaching online, and we're using the online platform. So that is the case why the flipped classroom is also comes in. So the blended, the word, and the importance of blended learning is much important in case of digital online learning. So in case of assessment, can we think about the open book exam? So for that, we should have some policy and regulations to have the open book exam, if we are not having any type of conventional mode of assessment. So in that way also, there is a possibility of conducting MCQ, having the scenario based question, but again there is a question on the assessment of practicals, how we are going to deal with that. No extra cost. Some courses obviously they are with some minimum cost. Coursera is also available, Udemy is there, edX is there, Future Learn is there, so that you can use the blackboard, and you can explain to the student how you want to teach them. So it's all about the teacher, how you want to deliver the quality education. So that is up to the faculty as well as the student, how they want to learn, what is their adaptability. Online teaching and learning platforms. So these are the online teaching learning platforms. So the college or the institute or the university, they can think about creating their own e-learn portal. They can have their e-forum, so that the student can come in, they can have chat there, and then they can ask the question regarding any assessment part or any lecture to the teacher directly, and they can have the decision on that particular point if they are not sure about any question. They can use the Google Classroom. Google have the many platform. Actually, the Hangout is there, and other many platform. The Microsoft Teams, the Zoom, like we are using now, right? Classroom screen, and also the virtual experiment. So virtual experiment also somewhere it is we can apply, but not all the times we can depend on the virtual experiment. Okay, So digital assessment. So as I told you earlier, digital assessment is also, you can do it by using the Google platform, so that only the access will be given to the student, but at the same time the student cannot see how we assess. The lecturer can assess their particular performance. So that is the advantage they have. So just I am going through the last my message, what message I want to give you to all of you regarding this pandemic situation, how we can cope up with this condition. So you need to manage your time very effectively, so the time management is much important in aspect of teacher as well as student. So student can do their work properly within time. They can take that particular time to complete the task that given by the teacher, and the teacher also need to plan accordingly for the assessment as well as for their lecture well before in hand, so that the student knows what type of particular tools the teacher is using, and also the way of learning is easy in that way. Okay, so again, coming to the next point is develop new skills to learn and teach. So in this time we can have development of our new skills, and we can learn some good things, the adopt some good skills in relations with the information technology. So obviously for achieving all this thing we need to have self-directed learning. So it's not like everybody like anyone will come with you and tell you like how to use that particular app, or how to implement that particular app in your teaching. So it needs some self initiation and involvement both from the teacher as well as from the student to learn something new that is not we are used to. Appropriate tools to assess. So it's not all about the tools only, the appropriate selection is also much important. Otherwise the assessment will be going to be failure in that case if you are not using proper tools. And again, coming to the last point is prepare for technology failures. So as we know that we cannot believe 100% on the technology. If the technology fails, then what to do next? As we know that because of this pandemic situation we are facing this problem, and then as a challenge we are taking as an opportunity of this, and we are delivering our lectures online. So in that case, if technology fails, what we need to do next, that also we need to think about. Okay, so with this short presentation I will stop here, and if you have any question you can type it in the message box here, or later you can convey with me, or you can email me directly. I have given my email ID also. Okay, any question anyone want to ask me? Dr. Sunil?
No, sir.
Okay. Okay, thank you very much.
Hello, sir.
Yeah.
Sir, please share your email ID on your screen.
Yeah, just a minute.
Right, sir?
Are you able to see me now?
Yes, sir.
The screen, okay. So just a minute. Yeah, I will share the email ID so that you can contact me.
Just put into the chat box, sir, so we all will get.
Yeah. So now you are able to see my screen now?
Yes, sir.
Okay. So just you can contact me on my email ID. I will just type in the message box. Okay. Thank you very much.
Yes, sir.
Thank you.
Thank you very much, Professor Praveen Kumar English, sir, from International Medical University, Malaysia. Sir had given us such and beautiful information how we are using the technique to teach the students via online video. yeah, virtual classes. Sir had given a very good information regarding this, how we are keeping our student busy, because it is a challenge to taking the online classes, how to keep motivating students to be present in our class and give the valuable feedback or ask the question to us in the class. So I again thank you very much to Praveen sir. Thank you very much. Now, yes sir, now I request Professor Mayur S Parmar sir. He is from Nova Southeastern University, Florida, USA. I welcome you, sir. Please, sir, uh, start your session. Thank you very much, sir.
So good morning, everyone. My name is Mayur Parmar. I'm assistant professor of pharmacology at the Nova Southeastern University, Florida, USA. So I just joined as a faculty. It's been 9 to 10 months, and before that, I was doing my postdoctoral research at University of Florida and did my PhD in neuroscience. And this has been a good journey for me to teach something pharmacology. It was exciting, and suddenly the COVID-19 issue, COVID-19 pandemic came, and then things changed. I had never taught online before or learned through online sources. And the challenge came, and I just accepted. And there were a lot of good tools from our university, which help us to provide a good education or continue education to the medical students and in this pandemic. And I will just talk about a couple of things, what we learned from our school. And and also here, as we are talking about education, I will be just talking about some of the challenges which we overall face at the school level also while promoting the education, because it's important for every one of us to know, being in college or university, but what at the school level, what are the challenges, how we can help too. So just a disclaimer that all the views expressed on this site are my own and do not represent any opinion or entity which I affiliated. These are my opinion and my interpretation, how I learned from this online tools which are available now in COVID-19. So this slide just shows the COVID-19 pandemic is having a dramatic impact on the world of work. So there are various sectors that have been affected. Social sectors, economic sectors that include transportation, connection, industry, manufacturing, and also one of the important sector which I consider has been affected is the education sector. I think we can't just let it go saying that we are staying at home. We can pause educating the students either in school or university. We can continue later because we are taking away some important time from the education career if we pause there. So the education need to go, continue. And for that, we have to use various online tools for now in order to continue education to our students. This slide just shows how the education crisis has occurred or impacted. So currently we are living among what is potentially one of the greatest threats in our lifetime to global education. So this just graph shows by March 28, 2020. It just shows the data from March 23, but it tells that by around 1.6 billion children and youth, either school or the university, are out of school in talking about 161 countries. And this is close to 80% of the world enrolled students and not learning the fundamental skill needed for life. So it's important for us to continue education in order for the students to learn the fundamental skills. Right? Go ahead. Dr. Sunil?
Hello, sir. Yes, sir.
Okay. No, I thought there was a question. That's why. No worry.
Please ask the question at the end of the session. I think it will be good.
No problem. Yeah. So what about COVID-19 education crisis? The immediate impact of the COVID-19 on the education globally is several other factors like losses in learning. Students are missing on their learning important classes, especially the labs. If they are in, let's say we are talking about School of Pharmacy, we do have essential labs that are going on, either it's pharmacology, medicine, chemistry, or pharmacognosy. The students are not learning, even though we are trying our best to teach them through online tools, but there is a loss of learning happening. And it's been a big challenges for university, how they are going to overcome those learning and teach either second year or third year pharmacy students or medical students the important labs. So there has been a lot of things that is impacted by COVID-19. There is an increased dropout rate or lower enrollment. So what I'm talking about is there are chances that the people, students, either school or university, who might, if this COVID-19 situation continues and the school or universities are not open, there are chances are that there will be increased dropout rates. And there are chances also with the lower enrollment, because if I talk about universities in USA, there are many kids who would like to have a good, along with their education, enjoy the campus life. And if the university are going to do the online teaching, they are at the same time, and there is one device available. So there are the challenges. So it's always best to, for the universities or the teachers, need to communicate with the students and make sure that they have online tools available. Another biggest challenge is accessibility by the poor family to all this online learning strategy. So it's related to internet connectivity, the price of it. And another challenging is the conducting exam for all of us as a teachers, because we want to make sure the students, if we are making them learn through online tools, they are learning. So one of the things which we all are trying to figure it out is how to conduct the exam and evaluate them. So the overcoming and minimizing the above challenges is crucial to prevent the negative effect of COVID-19 on student learning. So it's very much important for us as the university administration or as a teachers to make sure the students are learning is not affected by COVID-19. And main thing one has to always remember, must focus on equity for our most vulnerable students, meaning a university has, or the professors need to make sure that all the students have this basic need accessibility. So when we are delivering a lecture, they have accessible. Don't assume that they might have this, tools available. So it's important, and we can help and strengthen the relation with the students to make them better person or succeed in career. So talking about what are the various tools that are available, which everyone or most of us are using. For example, our university, currently we are using a tool called Zoom for lecture delivery. The good advantage when I joined this university, Nova Southeastern, that we have multiple campuses across US, and we have been delivering online courses at multiple campuses. So we have access to all this online delivery tools. So it was very easy for our university to kickstart this learning and to reach out to the students. But still, we are able to notice various weaknesses in this COVID-19 situation, because the more we communicate with the students, we are able to learn what are the challenges. So I will talk to you about the challenges which we learn, and hopefully everyone can, university admission can learn and pass on or successfully implement. So online live lecture delivery. So one of the things which we are doing in order to effectively delivering lectures, so the students are learning, is online live lectures. So we can deliver through Zoom a lecture to probably more than 1,000 students. We are capable of that, but we are preferring, because of internet connectivity issues, we have many students out of 500 students, they do not have access to the internet. Even though if they have access to the internet, internet flexibility is very wide, and sometimes it gets disconnected. So it's very difficult. So many of our lectures are also pre-recorded on Zoom, and they are posted in advance. So the students, when they look into their Blackboard or the Canvas, they are able to look at this video recording. So it's easy, and they don't have to rely on online live lecture based on the internet availability. So it's important that one can utilize this tool as a teacher, that they can ask their teachers to record the video in their spare time, prepare the PowerPoint, and just post on various platforms such as Canvas, and the students can have access to those videos at any time, and they don't have to be present during the specific time. Because as I said, in a family there can be multiple siblings, and they might be attending the lectures for the university at the same time. It becomes difficult. So this tool is very important to consider, that one can record the video and provide and upload them. So what are the challenges still one can face? One can easily do all these things, but what are the challenges? Educator will be overwhelmed and unsupported to do their jobs well. So we know many of the faculty might be not well versed with online tools, and this can be challenging and it can be overwhelming, and it can make one feel that what if he or she does not succeed in doing jobs. So these are the challenges, so which require very much important support from the university administration to make sure they are learning through various training programs, so they feel comfortable to deliver a successful lecture. So multiple learnings, so which require training to the faculty, also sometimes training to the students how to access this material. Content transfer to the students. So it's important for the university administration.
Sir, we have to finish soon, sir.
Okay. So let me just complete by following with the learning. So one has to make sure there is an internet connectivity problem. Okay, so just one more important thing, there are various tools universities can apply in order to conduct examination for successful student evaluation, such as ExamSoft. There is a software called Respondents, but however, there is, as I said, internet is always a big problem with many people using. This sometimes fails, so there is a system people university are occupying using called honor system, where they just believe the students are doing correct and they are not copying from the system. And some universities are developing their own online examinations tools. So these are really good opportunity which the university or the teachers can learn. And I will just end with this particular important slide, why there is opportunity to leverage here. It will provide blended learning approaches or tool will be tried and tested. It will allow remote learning implementation by university. Teachers and school will receive most respect, because if you are able to deliver the classes under such scenario, they will respect that the teachers are trying their best to educate them. The quality teaching and learning material will be better curated and more wisely used. There is a potential for the teachers to collaborate and grow and help improve learning. There is no boundaries, like one can collaborate with universities from other, like what we are doing currently in terms of webinar. We can easily connect it through Zoom. We can attend webinars or research conferences anytime. So these are the various tools which the lecturers or the professors utilize and learn from this COVID-19 and continue. Even though universities are open or colleges get open, one can always take best use of the learnings. And with that, I just end. If you have any questions, just let me know.
Okay, sir. Thank you very much, sir. Dr. Mayuresh Parmar, sir. And thank you for being us with keynote speaker. Sir has given the valuable information regarding the needs of a student and how the quality teaching and learning methods can be adopted via this virtual COVID-19 situation. How the online webinars and research conferences can be organized, and how we are going to be part in this program. Now, now I would like to call our institute one professor, Professor Arpita Mishra Madam, for vote of thanks.
Thank you, sir. Thank you, Principal, sir. It's my privilege to have been asked to propose a vote of thanks on this occasion. I On behalf of Apex Institute of Pharmacy and the volunteers, extend a very hearty vote of thanks to the honorable delegates who blessed us with their presence and took out valuable time of your busy schedule. I must mention our deep sense of appreciation for Mr. Praveen Kumar Ingle sir from International Medical University for his work. Thank you, sir. We are inspired by Mr. Sunil Mohite sir from TCS Toronto, Canada. The way he explained the topic was exemplary for every one of us. And also, I would like to extend a special thanks to Professor Dr. Mayur S. Parmar sir for sharing his inspirational knowledge with us. I also wish to express my gratitude to our principal, Dr. Sunil Mistry sir, for providing encouragement and support. Last but not least, I am very grateful to our chairman, sir, Dr. S.K. Singh, sir, for giving us an opportunity to organize this event. Thank you.
Anybody want to say something? I think it's very good and informative session. Some trouble it created between because due to the internet condition or in poor network position. I again thankful to Dr. Praveen Kumar sir. Thank you to Dr. Sunil Mohite sir, and thank you to Mayur S. Pamar sir. Also, I would like to thank to all the participants from different part of India and abroad to join with us for this lovely and informative session. It is truly international webinar we are having together, and thank you. If our chairman sir is, I think, want to say something. Uh, Sir is not audible, I think. So I again thanks to all participants and all keynote speakers. They have given a very valuable and good information to how we are going to change this challenge into opportunity. How to use our knowledge, because it is the situation in which everybody has to be creative. When we are going to be creative, then we will give the best of our students, to the society. So keep innovating day to day,